Welcome to the webinar, Building a Quality Culture in Public Health. This webinar is brought to you by the Illinois Accreditation Task Force, and this project is funded through the Multi-State Learning Collaborative Lead States in Public Health Quality Improvement, funded by the Robert Wood Johnson Foundation. My name is Laurie Call, and I'm the Director for the Center for Community Capacity Development at the Illinois Public Health Institute, and I am pleased to introduce our presenter today. Our presenter is Cindan Gizzi. Cindan is an MPH and currently the Deputy Director Pro Tem at the Tacoma Pierce County Health Department in Washington State. Cindan leads the department's Office of Community Assessment, Planning, and Performance Management Functions and Vital Records Office. Cindan is responsible for guiding and implementing the evaluation of multiple programs, the monitoring and reporting of the health of Pierce County residents, and the provision of assessment data for public health planning, practice, and policy setting. I've had the pleasure of working with Cindan through the Multi-State Learning Collaborative, and I guarantee that this presentation is very informative and exciting, and I'm happy to be able to bring this to all of you today. So without further ado, I'd like to turn things over to Cindan, and we'll hear her presentation.
Thanks so much, Laurie, and it's been great working with you too. I'm thrilled to be taping this webinar and talking to you folks in Illinois. I was born in Evanston, raised in Peoria, so I feel like I'm home to some extent. So thanks for allowing me to share our experience in the Tacoma Pierce County Health Department with you. I'm going to be talking about building a quality culture in public health, and again, sharing some of the lessons that we've learned throughout the past 5 to 6 years that we've been working on building quality infrastructure and building a quality culture at our local health department. You're going to hear me use some different terms such as quality culture. Sometimes I talk about big QI versus little QI. Sometimes we talk about quality infrastructure. I'm going to be using those terms throughout the presentation. And these are all really ways of talking about how to ensure efficient and effective public health programs across your entire department. And this is really what we're all working for. So I'm not great at being very specific with some of my definitions, so I am using those terms interchangeably. Before I get started, I want to acknowledge a few people. Marnie Mason from the state of Washington, she's a consultant. I think she's been working with you guys in Illinois. She also provided consultation and support for us as we've been building our quality improvement program here. Scott Davis, who's the Quality Improvement Coordinator at our health department, helped put together some of these slides, and he's been doing a fabulous job building our quality improvement infrastructure here at our department. And then I'm also going to be sharing some slides from the University of Minnesota. Bill Riley and Jack Moran, who's also with the Public Health Foundation, were kind enough to share some of their information, and you'll see they're building blocks of a quality culture, and so I want to definitely thank them and acknowledge them. My main point really in this webinar is that it's important to build the quality culture, that big QI, as you also start building your individual QI projects. This is my big take-home message, and I'll tell it to you up front, is that investing time in building a quality culture and quality improvement infrastructure will pay off so much in the end, several-fold at the end, if you do it at the same time that you're also implementing what we call little QI, or specific quality improvement projects. So today's agenda, I'm going to give you a definition of quality culture, what I'm talking about. I'm going to talk a lot about our own effort to build a quality culture and infrastructure at Tacoma Pierce County Health Department. I'm going to present what we call the Quality Trilogy, which is actually Duran's original Quality Trilogy. We've modified it and have been using that as a model for our public health agency. I'm going to talk just briefly about how you can measure your quality improvement culture infrastructure in your agency. And throughout the entire presentation, I'm going to share lessons learned. And you'll see the clip art that I've included just to make the presentation a little bit more interesting has to do with the building theme. I used to use Bob the Builder and then realized that I was probably infringing on copyright. So now I just talk about how we use a lot of tools, and building is a great theme for quality improvement. So you'll see that throughout as well. Okay, so Pierce County, Washington, we live in what I think is one of the most beautiful counties in the state, or in the nation. We live right by Puget Sound. We have Mount Rainier in our county, and we're about 45 miles south of the Seattle area. We have about 850,000 people in our county. Our main city is Tacoma. It's a couple 100,000. Our health department, we consider it mid-size. We have about 275 staff. You may consider that to be very large, and I will try to talk about how smaller LHJs can implement a quality culture. So building a quality culture. Before I share some of the QI projects and activities that we've conducted at our agency, I wanted to talk about culture change. You know, if your organization is not accustomed to cultivating a learning environment or embracing quality improvement principles, as ours wasn't when we started this 5 or 6 years ago, you're probably heading for a big level of culture change. You can conduct individual quality improvement projects and activities without this major culture change, but you really can't implement big QI or really successfully implement some of the quality infrastructure items I'm going to talk about without building a quality culture. So you can see here there's a strong overlap between the basic principles of quality that I'm sure Marnie Mason has shared with you guys, overlap between those principles and these characteristics of a quality culture. Continuous improvement, you know, using data to answer questions and make decisions, consistently knowing and involving your stakeholders, empowering your frontline staff to question current processes, team approaches, et cetera, and leadership commitment. Those are all part of a quality culture. And what's important about that is that it's spread throughout your entire department, you know, vertically and horizontally. So a lesson that we've learned is that culture change is really difficult. I don't mean to scare anyone off, but you know, this is something where your leaders' words and actions will be scrutinized, and they have to support this at every step of the way. The first time they say or do something that is contradictory to a quality culture, unfortunately, that's what people kind of grab onto. So it's really important to get your leaders to buy into this and to really believe and support quality culture. It's really important to create a safe environment for staff to learn from mistakes and to foster an environment where people learn. It's okay to fail, but you need to learn from that and make improvements. And this might seem silly, but active listening is so important. Really listening to people, reflecting back what they're saying, and helping them work through some of the problems and issues that they're dealing with. The building blocks of a quality culture, this comes from the Jack Moran, University of Minnesota, and Bill Riley. I found this really useful. They describe 6 building blocks or components of a quality culture, and you see them listed on the screen here. Now, there's a Word document that I think you'll find attached or part of the handouts that go along with this webinar that talk about each one of these building blocks, and I'm just going to briefly walk through them. So commitment really talks about commitment from senior management. This is really the driving force. And as a champion of QI, and I'm assuming all of you are champions of QI in your agency, you know, part of your job is, if you're not part of senior management, is to figure out what's going to motivate them to buy into a quality culture. Is it because they believe in the value of data? Is it because they want your health department to be the best? That's where we started from. We had a director who was very motivated for us to be the best. And so I talked to him about the quality culture and quality infrastructure as that's what's going to take us to being the best. Capability, this is really about having your staff being able, through training, you know, receiving training and teamwork, to be able to focus on continuous skill improvement so that people have the skills and the tools they need to do this work, and that they're self-motivated to make things better. understanding of your customer's expectations, your customer's needs. This is really, when we talk about quality planning a little bit further, this is really, it's where your customer drives what you're doing. Empowerment. This is where frontline staff, middle managers, senior management all feel empowered to make improvements and to suggest improvements for change. Process focus. This is where not only you have a focus on improving your outcomes, but also the efficiency of your processes, and where commitment to quality is apparent on a day-to-day basis. And finally, institutionalization. Is quality everywhere in your department? Is continuous improvement the norm in your department? So again, if you have the handout, you'll see more definitions of these building blocks. But I think it's a great way to capture what quality culture is all about. So now I'm going to take some time to talk to you about the quality improvement initiative that we've engaged in at the Tacoma Pierce County Health Department. In 2006, we were fortunate enough to receive a mini grant from our state health department, the Washington State Department of Health, through their participation in the first multi-state learning collaborative. And we used the mini grant to not only select our first quality improvement team, but also to build quality improvement infrastructure at our agency. We in Washington State have a standards review that's been going on since about 2000. We don't have a state accreditation system, but every 3 years all of our local health departments and the state agency go through a standards review. And in our 2005 standards review, we were not able to demonstrate that we met 2 measures around quality improvement. So we wanted to improve this for our next cycle, our next review in 2008. So that's why we embarked upon a quality improvement infrastructure initiative. So the main components of our quality improvement infrastructure at our agency include our Quality Improvement Council. I'm not sure how many folks out there have a Quality Improvement Council, but let me just describe how it works in our agency. You can see the mission on the screen, and the members of the Quality Improvement Council are all our senior managers. So there's an exact complete horizontal representation of our entire department. It's led by our director, and it's facilitated or coordinated by an assessment staff person. So we're fortunate enough to have our Office of Community Assessment, which has about 8 folks in it. And so she's a population-based public health nurse. She facilitates and coordinates our Quality Improvement Council. We also do have support staff who take meeting minutes. We meet monthly, and this group really, because they're the senior managers, these are the people who can make the key decisions about resources, where we're going to have our next QI project. They're going to be the ones who can allocate staff to QI projects. They really, they also pose key questions to QI teams who come back and report their results. You know, they challenge the teams. They keep folks aligned with our quality improvement plan, which I'll talk about next. So this has been a great group for us, and we used to meet at the end of our management team. Here's a learning that we had. We used to meet at the end of our regular management team meetings because those are the same people. But we found that, you know, as we started talking about budget and strategic planning, that this would often get bumped off the agenda. So then we decided to set a separate time. It's the 4th Tuesday of every month at 1 o'clock, so we all have it on our calendars and make it a higher priority for us. Quality Improvement Plan and Evaluation. So we have an annual Quality Improvement Plan, and by the way, I'm happy to share that. My contact information is at the end of this presentation, and so please send me an email if you would like to take a look at our most recent plan. It's actually a 2010-2011 18-month plan. And in it, we list our major activities. We include a calendar, which I'll show you in a minute. Most importantly, we identify people responsible, timelines. The other thing that we do is we have an annual evaluation of our QI plan, where we evaluate all the major components of our QI initiative. Here's an outline of our most recent 2010-2011 QI plan. So you can see it includes scope and structure. There's some, we have our mission. We talk about the organizational structure of it. We talk about roles and responsibilities. And that includes the role and responsibility of every single staff person. We have a role and responsibility of people who are not on the QI Council, just every staff person here, and how they are responsible for looking for opportunities to integrate quality improvement in their everyday work. We list our quality improvement activities. You can see all of them there, and I don't have time, unfortunately, to go through all of them, but I will talk about a couple. We talk about how we align our quality improvement initiative with other kind of department-wide or system-wide initiatives. Our employee performance evaluations, we now have something in our employee performance evaluations, criteria that every staff person is measured against during their annual evaluation around use of quality improvement and quality planning tools and techniques. We also align it with our strategic planning document. And we have our QI Council calendar, which here's a little snapshot, a portion of our QI calendar. And you can see that it lists our quality projects, the different initiatives that we have going on, who's responsible, the completion date, what date it comes to the QI Council for review, and then if we have any additional review dates. For example, some of this we present to our Board of Health. So again, it's just a nice way of keeping us on track and saying who's responsible and what the timeline is. So a lesson that we've learned, I've said this before, but I will say it again, is that we've really felt that we've maximized our efforts by starting big QI and little QI. And again, by little QI, I mean the specific sort of time-limited quality improvement projects. By starting that at the same time, I really encourage you to take the time to build infrastructure in your agency. It will save you time later. But while you're doing that, take baby steps and be okay with it. Marnie Mason always used to tell me, you know, you guys are still in preschool when you think about your growth and quality improvement, and that's okay. Just keep moving forward. And I was so thrilled where now she says that we're probably in lower elementary right now. It's only taken us 6 years to get to lower elementary, but I'm happy with that because the direction that we're going is a positive one. So be okay with taking baby steps. This is tough stuff. Identify what is crucial to measure and only measure that. There's a ton of data out there. Really make measures, performance measures, meaningful to people and identify what is the best thing to measure and only spend your resources on measuring that. And again, build success and change your culture one QI project at a time moving forward. So here's an example of some of the quality improvement, quality planning projects that we've taken on at our department. I don't have time to go through all of these, but a couple of points. You can see that we conduct quality projects in both kind of our administrative services, those areas that touch every single program in our department. We also have some QI projects that are programmatic in nature. So for example, chlamydia incidents. We have an ongoing quality team that comes together monthly, and they have been meeting actually for a couple of years and probably will continue to meet because this is a tough issue for us. Our chlamydia rates are, we were the highest rate in the state. Now we're the second highest rate. But they've been using multiple quality improvement tools such as Pareto charts, fishbones, workflow analyses, et cetera. They've set multiple performance measures at different levels that they're trying to reach. And they really focused on doing a better job of case contact, case follow-up, contacting partners, getting partners into treatment. And we've been tracking our positivity rates, which is the percent of tests that are positive for chlamydia, as well as our chlamydia incidents. And we're starting to see declines. And I really think that's a direct result of the work that they're doing in this ongoing quality improvement team. They actually won last year our team award. We have different awards, employee awards, and that group won our team award last year. They've done a great job. Another one that I'll highlight, our maintenance help desk request process. So this was a rapid cycle improvement project. It included multiple PDSA cycles, and they focused on improving the request process. So from the starting point where someone sends in an email saying, I need maintenance help, to the end point of where the project has been completed and the originator is satisfied with the outcome. And they looked at every step of the process and implemented multiple improvements along the way, reduced their number of steps, improved communication, and we have an ongoing administrative services customer satisfaction survey that we do, and their scores have been going up ever since they began this project. Finally, I'm going to talk about obesity prevention on the programmatic side a little bit later on, but we've used some nice quality planning techniques, and I'll share a couple stories around that project as well. Okay, evaluation of quality improvement plan. So every year we evaluate our quality improvement initiative and our plan. There are typically 7 components of our evaluation. Again, I won't go through all of these, but they include looking at the overall percentage of performance measures that we've achieved, looking at the impact and outcomes of the improvement actions from QI projects, indicators. We have a set of health improvement indicators that we look at, and we look at what percentage of those we've achieved. Completion rate of activities in our QI Council calendar. Also evaluation of our QI Council meetings. At the end of every QI Council meeting, our members answer 3 questions. Was this meeting helpful to you and why? Was there something that could have been improved? And was this meeting relevant to your work? Why or why not? And so based on their responses after every meeting to those 3 questions, we will make some improvements or changes along the way and evaluate our council. We have quantitative and qualitative components both to our evaluation. We were really fortunate starting in 2009 to be the recipients of a Robert Wood Johnson Foundation grant that focused on the evaluation of quality improvement in public health. And so we were able to really enhance our evaluation last year. And what that evaluation demonstrated was that we've done a great job in some areas of building a quality culture, but we also had 8 areas where we still needed to work on, and so I'll just briefly share those with you. We found that we needed to do a better job of recognizing and acknowledging staff for their quality improvement work, especially by our senior managers who sit on the Quality Improvement Council. And I'm sure you've heard this before if you've worked in quality improvement for long, but celebration and acknowledgement of your successes and your work is so important. So we learned that staff were feeling that we needed to do a better job of that. We also needed to better align our QI plan with the major department initiatives, which is why now it's in our quality improvement plan. We talk about how we align with annual employee performance evaluations, and we talk about how the strategic plan, which we're just about at the end of our strategic planning process, how that should guide our quality improvement activities and initiatives. For example, our performance measures, our strategic plan, what we're trying to accomplish, our strategic directions should inform which performance measures we continually collect data on and report on. There are other linkages as well. But we needed to do a better job of aligning those things. We needed to increase our knowledge about the QI plan by QI teams and other staff. So QI teams were sort of off in their little box working on their specific project. We needed to help them understand how their team fit into our larger QI infrastructure or larger attempt to build a QI culture. We needed to provide additional training for QI team members. They said the training we gave them was great. We do typically kind of a just-in-time training model, but they said they wanted additional training. We needed to do a better job of encouraging staff to apply QI methods and tools in other areas of the health department or in their daily work, which is, again, why we included it in the annual employee evaluation and why we're just starting to kick off a 3-day training that focuses on using quality improvement, leading quality improvement teams, quality planning teams, that's available to staff at our health department. We needed to do a better job on focusing on methods or activities to ensure those sustained improvements. We were doing a great job of demonstrating initial improvements, but then the team would sort of peter out and go away. And so what we've done is not only do teams have to give a final report to the Quality Improvement Council, they have to come back in 3 to 6 months after their team or their project has ended to tell us how they're doing in sustaining the improvements. Are they still monitoring data to show that their improvements are sustained, et cetera? We need to add regular consultation support during QI teams, so not just the just-in-time training, but some additional consultation and technical assistance throughout the project. And we needed to talk to staff more about the contribution of performance measures, data collection, why it's important for people to identify and develop performance measures that are relevant to their work and report to the Quality Improvement Council. We report those quarterly to our council. So I'm going to talk about performance measures a little bit more. We actually have 2 different levels of performance measures at our agency. We have what we call department level measures, and these are, right now we have 12 of those. Again, because our strategic planning process wasn't done, we modeled them after the Healthy People 2010. This was before 2020 came out, but the Healthy People 2010 leading health indicators. Plus, since we're always a little bit unique and different, we added 2 more. So these are what I would call population-based, much longer-term outcomes. These are high-level performance measures of where we're trying to go, what we want to do with the health of our residents. And these typically we don't report on quarterly. We still check in with them, but a lot of times we're getting data from BRFIS, the Behavioral Risk Factor Surveillance System, so we can only report on these annually. So that's our high level. Then we have what we call division level measures. And they're about, I'd say 10 to 20 performance measures per division. And we have 3 main programmatic divisions plus administrative services. And all 4 of those divisions have performance measures. Here are 2 examples of the types of performance measures that we use. So they're more focused on process reports or outputs or short-term outcomes. And again, we report these quarterly to our Quality Improvement Council. Here's a subset, an example of our department performance measures. Again, these are in our Quality Improvement Plan. You can see we've got the objective, the measure, and the person responsible for reporting the data. This is an example. I threw this in here to show you. It's a dashboard that we have shared with our Board of Health. It's an older one, but you can see how we want it to be really transparent and share our data and results with the board. The green means that the benchmark or the target was reached or exceeded. Yellow means that they came, I think, within 85% of the target or benchmark or higher. And then red, which I don't think there are any on the screen, I can't quite see the last row, but that means that they fell they achieved less than 85% of the target or benchmark. And we shared these with the board, and there was a lot of trepidation about sharing anything that was not a green with the board, and would they would they understand that this is an improvement process and that it's not necessarily a bad thing to see some yellow or red, that it's all about being honest with what's going on and looking for ways to improve things. And our board was great with this. They got it right away. And we're now looking at not just providing one snapshot in time to our board, but looking at trend charts. We've been at this long enough. We've had some of the same performance measures where now we can look at trend charts and history and say, well, maybe this year was a fluke. Maybe, it's consistent with sort of seasonal patterns that we've observed in the past. So that's where we're moving to. It's not just showing one snapshot in time, but showing the board kind of trends and how we're doing compared to trend charts, or using run charts and trend charts. Ongoing program quality. So this, you probably heard talk about continuous quality improvement. So this is the C, the continuous, in CQI. And we've really, in the past year, focused on this. We've really talked about how ongoing program quality, or CQI, it's really how we do our work. Quality improvement is not just a special project that you do for 3 months and then it goes away. This is really how we want quality to be a part of everyone's daily job. So, for example, I manage our Vital Records office. And so the whole team, we have a staff of, I think, 5 in Vital Records. And so the whole team kind of went through some training and have looked at where throughout their entire program are opportunities for improvement. They did some great fishbone diagrams and looked at, again, used Pareto charts and looked at sort of cause and effect and used the 5 whys and identified a number of areas where they could improve. They all voted and selected on point-of-sale system as their first project. And for those of you who aren't familiar, point-of-sale is it's a software program, a computer program, that allows them to sell and receive money for birth and death certificates. So it's like a cashier front counter system. And they had been experiencing tremendous delays periodically with this system, up to like 45 minutes, where they wouldn't be able to process someone's order for 45 minutes, so they'd have to go back to the customer and say, I'm sorry, we're experiencing computer delays, and so we'll have to do this manually, and then we'll enter it into the system later. And they would send periodic help desk requests to our IT staff saying, oh, we're getting a slowdown again. And IT staff would come up, take a look, and they wouldn't be able to figure out the problem. This had been going on for 4 years. So finally, Scott Davis, our quality improvement coordinator, worked with them and helped them understand how collecting a little bit of data could really help out. So he asked them to, every time that there was a slowdown in the system, to just collect some, I think it was 5 simple things: the day of the week, the time of day, the number of transactions, so, number of death or birth certificates in the order, and there were a couple other variables that I can't remember off the top of my head. And they would literally go to the wall. They just had a big piece of paper up on the wall, and they would write down those, variables that they collected and sort of timestamp it. And at the end of 2 weeks, they analyzed the data, and lo and behold, the only variable that they collected that had a relationship with the amount of time it took to process the order was number of orders, or number of items in the order. So when someone came and said, I want to buy 20 death certificates, that order tended to cause these long delays. So then they collected one other piece of information. Our environmental health program uses the same system at their front counter to sell permits. So we set up a little experiment where environmental health saved an order that had about the same number of transactions as a Vital Records order, and they agreed at the same time of day to enter that into the system. So they did that. Vital Records experienced a longer delay than environmental health did, by far. It was like quadruple the amount of time it took. So with those 2 pieces of information, they submitted another help desk request to IT. IT responded within 45 minutes, came up, took another look, and with just that amount of data, they were able to pinpoint the problem and fix it within 2 hours, something that took 4 years to fix. With just a little bit of data and investigation and using some quality, pretty simple quality improvement tools, helped them fix the problem within 2 hours. It was an amazing success that really motivated Vital Records staff to continue to look at the next project and the next project of where they could improve their processes, decrease inefficiencies, et cetera. So I want to talk a little bit more. I've already really mentioned these 2 examples of how to integrate quality improvement throughout your agency. We like I said, strategic planning guides the selection of performance measures. It also guides which health indicators. There are multiple health indicator sets out there right now. The MATCH set out of the University of Wisconsin. There are other maternal child health focused indicator sets. There are some from the Department of Health and Human Services. We have our own state indicator set. We have an indicator set that our own department created. And so we use QI and strategic planning to sort of help guide which of those indicators we're going to be monitoring and wrap that into our quality improvement program. And I talked about the employee performance reviews as well. But again, we look for every opportunity when we have a system-wide effort, how does that integrate into QI? What are the relationships? How does it all fit together? We're constantly asking that question. A lesson I want to share, and I mentioned this briefly before, but is to really use your assessment staff. These, you can see 4 ways that we use assessment staff, and these can be epidemiologists, they can be qualitative data experts, nurses who have a strength in data analysis, but this is how we use our assessment staff to support our quality improvement initiative. And I know that a lot of local health departments are so strapped right now, and many small local health departments don't even have assessment staff. They might not even have a portion of an FTE focused on assessment. So what I tell people is that you want someone who has a good right and left brain kind of proportion to them. So you want someone who has the data side of their brain working, someone who isn't afraid of data. But you also need someone who's pretty good at working with people. Quality improvement, even though it's a focus on process, not people, it involves a lot of people. It involves leading teams. It involves motivating people. So you really want people who are both good at data and the people side of things to be your champions of QI, to be your team leaders, to provide technical assistance to teams. We've really found that to be valuable. Another lesson is that implementing quality culture takes top-down and bottom-up efforts. The top-down is really more important. As I said, you must have the director actively leading the initiative. Find other high-level champions and praise their efforts. And finally, make QI the easy choice for managers and staff. Help them understand that developing performance measures really is going to help them achieve their goals. That's what they're trying to do. They're trying to do good work. Quality improvement should be the easy way for them to do that. Quality improvement activities, some lessons that we've learned around conducting QI activities. Again, it's really critical to make data and reporting meaningful to staff. They have to see how this is going to help them in their jobs. With performance measures, we started out with 240 performance measures. I think I sort of bit off more than we can chew. I was way too energetic about this, thinking that we could monitor 240 performance measures quarterly and report them to the QIC, et cetera. More is not necessarily better. We now identify 70 performance measures. And again, because they're more meaningful to staff, it works better for us. We've also learned that resource levels actually decline after the first data reporting period. So it does take a lot to do these QI activities, to develop performance measures. But then it takes less and less time as people get more and more comfortable with this. And staff need lots of practice and training to develop good performance measures. We've provided, I think, 3 sets of training for staff on how do you develop good performance measures and collect and report data on those. So I'm going to talk about the quality trilogy that we've used. This is a model or approach that we've used in our health department. I think it's a nice way to incorporate quality into everything we do at our department. Here's the model. And again, as I mentioned, this is it's a modified Duran model. Scott Davis, our QI coordinator, received his training at the Duran Institute. And so he took that model and kind of modified it so that he used terminology, assess, define, analyze, change, evaluate, that's more common to public health. We're trying to make the language that we use in quality match up with the language we use in public health. So it's not new terminology. It's the same terminology we've always used. So this is kind of similar to PDSA, although there's a lot, assess, define, analyze. Those are all kind of your P, your planning. And then change is sort of your D, your do. Evaluate is really your study, and then your act is sort of included in evaluate here, where you say act on exceptions. You can also see that I've drawn some lines and linkages to community health assessment, where you can use community health assessment in that assess phase, as well as community health improvement planning in that analyze phase. And I know you guys have done a lot of work in Illinois. You've done a great job around your community health improvement planning and using quality planning in that effort. But I just wanted to sort of draw some alignments and show that this all fits together. It's all a part of the same quality model. So as we talk about quality at our agency, we talk about the quality trilogy, being quality improvement, quality planning, and quality control. Again, that's a Joanne model. Marnie Mason has presented on this. She may have talked to you guys in Illinois about this. Quality improvement, I think we're all familiar with. Quality planning is really a set of tools. We talk about these as toolboxes. It's a set of tools that you can use when you're at the start of a project. Again, I know you've done a lot with this around community health improvement planning. Some of the tools are the same as QI tools. Those toolboxes overlap. Some of the tools are different. But they really help you focus on your customer, which is so key, and begin a quality planning process for whatever project you're working on. And then quality control, the third phase in the quality trilogy. This is really about sustaining your gains and setting up performance measures and controls in your processes so that you can continually monitor and improve and report back on your performance measures to see how you're doing. So we talk a lot about 3 different toolboxes. Some of them have the same tools and they overlap, but some of them have different tools. I want to touch just briefly, what happens at our department often is that we end up doing what we call a QI-QP hybrid project. And again, I think as we in public health get more familiar with both quality improvement tools and quality planning tools, we can sort of see how some projects may start where you think you have a quality improvement approach. And when you get into it, you actually find that there really aren't nicely defined sort of narrow root causes, right, that we like to find and then develop interventions and improvements for. And so at that point, you might have to sort of start back from the beginning and say, you know what, maybe we start from scratch and take a quality planning approach to this and talk to some of our customers and see what their needs are and start using some quality planning tools. You may bring in quality planning when you have large portions or even all of your process may need to be redesigned, but you don't want to do a complete sort of business process redesign, which I don't know if people are familiar with that, but it's fairly elaborate. It takes a lot of time. If you don't want to go down that road into sort of redesigning, re-engineering processes, you can pull out your quality planning toolbox and see if maybe some of those tools can get you where you need to go. This is a quote, Napoleon Dynamite, that Scott Davis loves. The liger is pretty much my favorite animal. Again, tiger, lion. We look for hybrids, or we allow hybrids in our QI projects whenever the need arises. This is just, I'm not going to go into detail on this, but this gives you an idea of some of the project steps involved in quality planning. So again, you can see the headings are using that same quality model: assess, define, analyze, change, and evaluate. But there's some slightly different project steps in there. And we have one of these for quality improvement, quality planning, and quality control, where it kind of documents each step that's used. So I want to talk briefly about how we applied some quality planning tools and concepts for a couple of obesity prevention projects. So the first one I want to just talk about where it was a concept where we were going to hire temporary part-time health educator to provide consultation and technical assistance to city and county planners. And the attempt was to include built environment concepts into the next round of city and county plans. So this was a CDC, or is a CDC best practice. It's focusing on changing systems and environment to make healthy eating and active living the easy choice for our residents in an effort to reduce obesity rates. And so, again, the idea was, hey, CDC lists this as a best practice. We'll hire someone. We had about $40,000. They could work with our city and county planners around built environment. And we stopped, though, and said, hey, have you talked to our city and county planners? Have you really, approached this using quality planning tools? And they said, well, 2 years ago we had this big forum, and some of the city and county planners came, and we sort of had conversations with them, and we think this will be a great approach to getting built environment into our county. But we said, well, have you talked to them lately? Have you talked to the city and county planners lately to ask them what they need from us? Well, no, we haven't done that. So we said, you know what, let's just take a couple days to do some key informant or customer interviews. Go back to kind of your basic quality planning concepts. Go back to your customer, know your customer, and let's ask them what they need from us. So we developed some very open-ended questions about their needs. Took 2 or 3 days to talk to maybe 6 or 7 city or county planners, and lo and behold, what they told us was they didn't need these services, that if we hired a temporary part-time health educator to provide consultation services to them, it would basically go unused. They already knew about built environment. They already knew it was important. They said, you know, we don't see the value in this. And they gave us some ideas of how we could spend our money elsewhere. So what it came down to was that our customers didn't need the services we were going to provide, even though it was a CDC best practice. It didn't fit for our community at this given time. So we didn't implement the program. That's kind of an example of what we call QP Light. We just used a few quality planning concepts. Then another application of quality planning in obesity prevention is around the Healthy School Grants program. And the concept is that we would offer mini grants to school districts to choose from a menu of, you know, best practice, again, sort of systems level, environmental focus, policy level interventions to address obesity prevention. The quality planning tools that we used included customer needs analyses, benchmarking, process controls, and performance measures. We did talk to the customers, school district nurses and policymakers. They helped us. They said they could use the money. They helped us define what the minimum amount would be for these mini grants, how much was enough to get them motivated to participate. They identified types of interventions they'd be willing to implement, and they identified barriers to participation. And an interesting question, we went back and forth about should we include body mass index as a measure of weight or obesity as a performance measure. And the general thought was that school districts would be opposed to collecting and reporting BMI because it's so controversial. And so that was one of the questions that we asked our customers when we did the needs analyses. And 15 out of our 16 school districts said, yeah, either they were currently collecting BMI data and they'd be willing to share it with us in aggregate form, or that they would be willing to start collecting it on the kids affected by their interventions when they participated in the program. So that was great. And again, all we had to do was to talk to our customers to find that out. So applications were reviewed, and actually they've actually completed review of the applications and have selected 5 school districts, and they're starting to work on their interventions. And they've agreed to performance measures that they're going to continually monitor. So we're excited about this project and to see how it comes out. Here's the quality planning model that was used for the Healthy School Grants. Again, I don't have a lot of time to kind of go through all of this in detail. I would say if you have questions about this, feel free to contact me. I can put you in touch with our program coordinator for this. But you can just kind of see some of the highlights of some of the tools and quality planning tools that were used in each phase of this. And here are their performance measures. You can see there's a mixture of process measures and outcome measures, leading up to a decrease in BMI. And then finally, I want to talk about how to measure quality culture in your agency. This goes back to the tool that I shared at the beginning, defining the building blocks of a quality culture. And this is how you can monitor and measure your progress, your agency's progress in building a quality improvement culture. So basically, using the 6 building blocks of a quality culture that I shared earlier, what you can do is rate your organization where it is today. You can also think about where you started from. If you're in the middle of your QI journey or quality culture journey, you can use that tool and sort of rate yourself in all 6 areas of where did you start from, where was your baseline, where are you today, and where do you think you will be, or more importantly, really, where do you want to be at this time next year? In 1 year, where do you want to be? And what the folks at University of Minnesota propose is just to use a very simple rating scale, 0 to 5. For each one of those 6 building blocks or components of a quality culture. Zero is you have nothing in place. And as Les Beich, who I'm sure some of you know through the MLC initiative, as he says, he quotes, he says his favorite quote is that someone in the MLC said, "It's okay to be a zero." And it is okay to be a zero. That's what quality improvement is all about. It's acknowledging if you're a zero, call it a zero. It's okay. But then talk about where you want to be in a year. Do you want to be at a 1 where you're just getting started? Do you think that you could move all the way up to a 2 or a 3 in a year in each one of those 6 components? And then what's great, I don't have an example here, but what's great is that you can then use a radar chart. And I know you guys have talked a lot about radar charts. And you can actually graph on a radar chart where you started, where you are today, and where you want to go. And shade those in and have a nice visual for where you can maybe get the most bang for your buck and where you want to work on, which are these areas you really want to work on in moving your agency toward a quality culture. The other thing that I would really recommend is that you take a few minutes to identify barriers to building a quality culture in your organization. Just list the top 3 barriers that you think are preventing you from having a quality culture, and what tools or what do you need to overcome them. And that's something that you can do alone, maybe as the QI champion, same with the rating scale for a quality culture, or if you have a quality improvement council or a senior management team, these are great exercises to do with those leadership groups or QI groups. And also what I tell people on identifying barriers is that lack of time can't be one of the barriers, because this is inherent in everything that we do in public health. There's always a lack of time. We don't have enough time to do everything that we want. So that can't be one of your 3 barriers. And that usually forces people to think of other types of barriers. So remember to celebrate your successes, no matter how small, and let's practice what we preach, and don't get defensive as things don't go as planned, and just learn from our mistakes. My final lesson is to borrow, copy, and plagiarize. Please use anything that I've given. Feel free to contact me if you want to look at our performance measures, our dashboards. I'm happy to share everything. Look at different industries. Obviously there are healthcare sectors and other industries that have done amazing work in quality improvement, and borrow and copy from them. Finally, I want to share some of the results that we've experienced with our QI initiative. I mentioned that we've been able to bring in some additional funding through the Robert Wood Johnson Foundation. We also just received some money passed through from CDC through the ACA initiative to become a performance management center for excellence in our state, where we're going to be providing training and technical assistance around quality improvement and performance management to other local health jurisdictions and tribal agencies in our state. And we've been able to achieve most of our performance measures at department and business unit levels. We've been able to improve or have sustained improvements for not all, but a lot of our QI projects. We've been able to meet 100% of our performance measures for our health indicators projects. We've been able to bring in that funding, and most importantly, I think this is a great illustration of leadership buy-in. Last year, when we were cutting other budgets due to funding cuts, our director thought quality improvement was so important that he added funding to hire our QI coordinator so that we could bring someone on site full-time who could help our entire staff use quality improvement in their everyday jobs. So we've increased our staffing and our funding for quality improvement at our agency, which really shows the dedication, I think, on behalf of our leadership. So thank you so much for this time, letting me share our experiences with you. Thanks for listening. And again, if you have any questions, I'm available, and I'm happy to share any tools or information that might be helpful. Thanks so much.
Thank you so much, Cindan. That was an excellent presentation with a lot of really useful information. I appreciated all of the examples that you shared, and really just giving us some very useful tips to get started, or no matter where people are at in their quality improvement journey. You've given some good advice. If you wouldn't mind advancing the slide for me. Um, Again, I wish to thank Cindan for her participation today and let all of you know that we will be following this session with a live Q&A conference call where Cindan will be available to answer questions. Look at your confirmation letter for the exact start time for that session, and on your screen you can go ahead and note the dial-in number and the passcode. This is also in your handout version of the slides and also in the confirmation letter. So we hope you will join us and have a few good questions ready to ask Cindan, and we'll make sure we get your questions answered. And finally, on our last slide, I just again wish to thank all of you. And if you have any training or technical assistance needs, feel free to contact me, Laurie Call, and my email address is on the screen, and we'll see if we can't connect you to the appropriate resources. So I appreciate your time today, and this concludes our webinar on infusing quality improvement into the culture of your organization.